Hey there! Are you curious about the genetic disorder that affects your nervous system? Want to know what causes a progressive decline in physical and mental abilities? Well, stick around because we're diving into Metachromatic Leukodystrophy, MLD for short. MLD is a rare genetic disorder that messes with your nervous system. Imagine a buildup of fats called sulfatides piling up in your cells. These fats damage the myelin, the protective sheath around your nerve fibers. That's like the insulation on electrical wires. When this insulation fails, your body's communication lines start to go haywire. So, how do you know if someone has MLD? It starts with a diagnosis. Doctors look for symptoms and conduct genetic tests to confirm the disorder. Speaking of symptoms, MLD can lead to a loss of motor skills like walking, sensory functions like touch and vision, and even speech difficulties. In severe cases, it can cause seizures and paralysis. The age when symptoms appear can vary. Late infantile MLD usually shows up around 2 years old. Juvenile MLD kicks in later, and adult onset MLD appears even further down the line. But no matter the age, the impact is significant. Now, let's talk about genetics. MLD is linked to mutations in the ARSA gene. This gene is supposed to make an enzyme called aryl sulfatase A, which helps break down sulfatides. When the ARSA gene mutates, this enzyme isn't produced correctly, leading to the harmful buildup of sulfatides. There's also another gene called PSAP that can be involved, but it's less common. MLD follows an autosomal recessive pattern, meaning both parents must be carriers of the mutated gene for their child to develop the disorder. So, what's the incidence rate? MLD is rare, impacting about 1 in 40,000 to 1 in 160,000 people worldwide. There's no significant difference between males and females in terms of who gets affected. Unfortunately, the survival rate for the late infantile form is quite low, with many children not surviving past childhood. However, those with juvenile or adult onset forms can live longer, though their quality of life is still heavily impacted. In conclusion, while there's currently no cure for MLD, there's hope on the horizon. Researchers are exploring treatments like enzyme replacement therapy and gene therapy. If you know someone affected by MLD, early diagnosis and supportive care are crucial. And remember, knowledge is power. Stay informed and stay hopeful. Thanks for watching. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more health insights. Catch you in the next video.